Hello, everyone. Thank you for joining me today. I would like to start by first just checking our technology, make sure that everyone can hear me and that everyone can see the screen. So if you can hear me, one, and if you can see the screen that says keep safe against COVID-19 part 2 of 2 with my picture, if you can raise your hand. Perfect. I see a lot of people raising their hand. There should be a little icon in your screen with a picture of a hand. That's how you raise your hand, for those of you who don't know. Okay, so I'm gonna trust that everyone can hear me and everyone can see the screen. Excellent. So first of all, I just want to thank everybody who reached out to me with the wonderful feedback after the first webinar that we had, the part 1. Was so happy to get the feedback and to see that this information is being helpful, to people. That's the reason why I'm doing it. If you didn't join us last week for part 1, the reason why I've decided to do these webinars is because I've come across so much information that I think would be extremely useful, for the public to know in just natural ways in how to boost up our immune system, against viral infections, in general. Obviously, there hasn't been at this point anything specifically proven against COVID-19. So what I'm going to be discussing and what I started discussing even on part 1 is just, in terms of general naturopathic recommendations or reviews that we have, on natural supplements. Today, we're going to talk more about herbal remedies, homeopathic remedies that have been helpful with other coronaviruses or just in general with viral infections. Okay. So I hope you find it helpful. I'm going to be making the recording for this part as well available for anyone, who would like to review the information again, or if you want to pass it along to anyone who you think may benefit, from this information. So please let me know. You can contact me by email at info@mynaturalclinic.com. or the phone number, which is in the screen, the 905-239-3900. Okay, so let's get started. So I think most of you know me, but for those of you who don't, my name is Sandra Miranda. I'm a naturopathic doctor and I have my clinic in Ajax. I've been practicing for 20 years. And I love to focus my practice in helping women with hormonal imbalances, women who are feeling stressed out, overwhelmed, not sleeping well at night, either having PMS, or menstrual irregularities or menopause, hot flashes, adrenal, problems, thyroid problems. These are the type of cases that I love to treat. Okay, so for today, we're going to first just quickly review, I wanted to review this just in case there's some people who didn't join us, in part 1, or just to remind people what the typical course usually is seen, with COVID-19 patients. And then I want to talk more about a few things that I didn't get a chance to talk about in part 1. So we're going to talk about lifestyle considerations. We're going to talk about other supplements that can be helpful. We're going to talk about some of the herbal remedies and then homeopathic remedies for those of you who take homeopathic remedies. Okay, so we reviewed this in part 1, but just to remind ourselves, this is a typical clinical course that is normally seen after somebody has been exposed, or have contacted this virus. So it can take anywhere between 2 and 11 days after exposure. Usually it's an average of 5 days to start feeling flu-like symptoms. So the more common symptoms are a fever. Usually we see a high fever, headaches, a dry cough, usually not a wet cough. Now this is of course not 100% of all the cases, but most of the time it's just a dry cough. Myalgias, which means body aches or back pain. Nausea, usually without vomiting. A lot of people have complained of a loss of sense of smell, lack of appetite, fatigue, and less common symptoms would be more abdominal discomfort with diarrhea, wheezing, dizziness. So it can happen, but the symptoms are less common. Okay. Then by the 5th day of symptoms, we usually start seeing the development of viral pneumonia if things continue progressing. And the viral pneumonia is directly from viral damage to the lung tissue. So there seems to be a lot of inflammation that we see with this viral infection. So it primarily affects our respiratory tract, so our lung tissue. And then it can also affect our heart and our vessels. And this is really important because as we keep on talking about the supplements and about the herbal remedies, it's all geared towards trying to decrease this level of inflammation. Because if we don't, then, and if things continue progressing, then we get by the 10th day of the symptoms, more or less, what's typically seen is patients get into what we call the cytokine storm syndrome. And this is when there's so many different inflammatory cytokines being released due to the virus that there seems to be like an overwhelming amount of a systemic inflammatory problem in your whole body. And that can lead to multiple organ failure and potentially death. Okay, so this is the stage that we want to try to avoid. So everything that I'm going to be talking about, you're going to hear me talk a lot about, this decreases inflammation and this is anti-inflammatory. And this is the reason why, we're telling people and maybe think about, these vitamins or maybe think about these herbal remedies as being possible options, that can help. Okay. Okay. So, of course, everything that I'm going to be talking about is just supplementary to the current recommendations. So the current recommendations being 1, wash your hands, and then again, wash your hands for 20 seconds. So you want to be singing the happy birthday song twice, before you're done washing your hands. You can use your hand sanitizer, making sure that it has at least 60% of the alcohol, but this does not replace you washing your hands. So you're only using the hand sanitizer until you're able to get home or you're able to get to a place where you can actually wash your hands. And the next one is really, really important. I can't emphasize this more. Avoid touching your eyes, your nose, your mouth without washing your hands, because you could be touching things and the virus could be in your fingers. And if you touch your eyes, nose, and mouth, then that's not a good idea. You want to try to clean and disinfect surfaces regularly, especially the ones that are touched, often. So that can be, for example, door handles or your phone, your cell phone. You want to make sure you clean that often. Keyboards, light switches, things like that. You also want to make sure that you're keeping physical distancing, right now. You want to avoid handshakes, hugging, standing or sitting close to people who are coughing or sneezing. If you are going to use a tissue to cough or sneeze, please throw it in the garbage right away. You want to obviously stop non-essential travel, right now. And if you get tested, if you develop any symptoms, you want to make sure that you contact the proper avenues. And I'll have those slides that I shared with you in part 1. I'll have it again at the end of this session, just in case you didn't get the information the first time around. Okay. Okay, any questions so far? So this was just pretty much a review of what we talked about in the first part. Okay, I don't see any questions yet, so I'm sure there will be as we keep on going. Okay, so again, a few reminders. Remember that it's the inflammation that we want to try to prevent. Remember that there has been no officially proven or prevention or cure or treatment for the COVID-19. Remember that there's no single magic bullet for COVID-19 as well. And the suggestions that I'm giving you are not to replace any possible treatment that you've been offered, you know, by your medical doctors. So I know a lot of people that come to see me, they have more of a preference, you know, to take more natural remedies, which is great. But with this COVID-19, if your symptoms do get more moderate to severe, you want to make sure that you're listening to what your medical doctor has to say. You can take the supplements, you know, as a complementary to conventional treatments, but for now, we don't have anything proven naturally that's going to help you. So please, you know, this is the time to get the benefits of both medicine. Most people do their best when they're combining both medicines, okay? So it's not the time to try to do this only naturally, especially if your symptoms are becoming more severe. Okay, so I can't emphasize that more. Yeah, so the best approach is having a multifactorial approach. Now, supplement-wise, we've already talked about the benefits of zinc, you know, especially if you're combining it with a flavonoid such as quercetin or combining it with green tea. So we talked about this, you know, in part 1. If you didn't get it, if you want the recording, let me know. And we also talked about the benefits of melatonin. So especially in the elderly, this seems to be one of the reasons why they think this virus is attacking the elderly. Well, that the elderly seems to have more severe cases. It could be in part because they usually are lacking more of the melatonin. So if you think you're low in melatonin, supplementing with some melatonin can be a great preventative option. Okay. Okay, so now let's start talking about some lifestyle recommendations, you know, or considerations. So the very first one is sleep. Okay. So the number of hours that we should be sleeping is a minimum of 7, ideally the 8 hours, you know, per night. Shorter sleep duration increases the risk of us getting an infectious type of illness. So one study actually found that less than 5 hours of sleep monitored over 7 consecutive days can increase our risk of developing a viral infection by 350% when compared to people who are sleeping more than 7 hours. So this is hugely significant, okay? So it's really, really important that you know this, that sleep deprivation will increase inflammation, you know, in your system, okay? The other benefit of sleeping for more hours is that sleep can increase melatonin levels, you know, in your body. It's important if you're currently not the type to sleep very well, if you don't have good sleeping routines, then this is probably the best time to start getting into one. So you want to make sure that you set a little alarm, you know, in your phone, you know, when you're going to start. One, turning off all the blue light. What I mean by blue light is I'm talking about your phone, YouTube, your laptop, your computer, your television, you know, all that. The blue, that's called blue light. Us being exposed to blue light suppresses our melatonin levels. And melatonin is the hormone that gives our brain that cue that it's time to go to sleep. Melatonin is the hormone that we need to get into a deeper sleep. Okay, so it's really important that, and I know it requires a lot of discipline, but it's going to make a big difference if you try to turn off all the blue light about an hour before you're actually planning to go to bed, okay? And the other way that we can encourage melatonin levels in our body is by turning off the lights, okay? So the light, you know, even just the regular light in our bedroom will suppress the levels of melatonin as well. So you want to, about an hour or so that you'd like to go to bed, you want to turn everything off, turn off the light. You can have like a little light if you still want to read, hopefully from just like a paperback, you know, and not from like a laptop or so. And that should help you, you know, to hopefully fall asleep a little bit quicker. And when you do fall asleep, to try to get into a deeper sleep. Okay, so really important. Stress. I keep on talking to all my patients about stress. A lot of people are feeling really anxious about this coronavirus. Please know that the psychological stress disrupts your immune system balance and increases inflammation. Okay, so when we're under stress, our adrenal glands, which is our glands, which is considered our stress glands, they secrete a hormone called adrenaline, right? Everybody has heard of adrenaline. And after the adrenaline gets secreted, then the next hormone that gets secreted trying to calm down our adrenaline is a hormone called cortisol, okay? Cortisol, so if we have a lot of adrenaline in our body, which will happen when we have a lot of stress, then our body will automatically start secreting a lot of cortisol, right? Makes sense? But the cortisol will suppress your immune response. So reducing it, even if at small intervals during the day, can make a big difference. Okay, and there's tons of studies, to support this information. So, so taking breaks, a lot of people think, that they're going to get ahead by working for 8 hours, 10 hours, 12 hours straight. They don't even take a lunch break. Like I'm sure a lot of you have done this before. That's not a good idea. You need to take your small breaks, even if it's like 5 minutes, 10 minutes, and just sit back, take a few deep breaths, walk around the block, walk around your office, well, now probably walk around your house, go outside to the backyard, get some fresh air. Even these short little intervals, of rest, will help to lower your cortisol, a bit, and that can make a big difference with your immune system, okay? So please keep that in mind. Mindfulness techniques, especially if you feel like you have been dealing with a lot of stress. I have a lot of patients who normally in a good day, they're dealing with a lot of stress, let alone now when they have this extra layer of being isolated, trying to work from home, and just knowing that all the systems are not working. I get a lot of complaints about that. And then just worrying, of course, about this virus. So if you feel like your level of overwhelm, if your level of anxiety, or just in general, your levels of stress have heightened, or you've always been the type to stress a lot, then you want to try some of these mindfulness techniques. So whether it's meditation or prayer, or just, creating some stillness, creating some quiet moments, even if it's for a few minutes, breathing exercises, there's the deep breathing exercises that you can do, guided imagery. It seems like no big deal, but it's amazing the benefits that we can get from these simple techniques, okay? Now, doing it once or twice is going to help you at that moment. But when you start doing it on a regular basis and it becomes a practice in your life, then you're going to find that you're benefiting not only during the few minutes that you're performing the mindfulness technique, but the benefit is going to stay with you throughout the whole day. Okay, so please don't forget about this advice. The recommendation right now is to do it for a minimum of 10 minutes, ideally closer to 30 minutes twice a day. And I know what a lot of you are thinking, oh, I don't have time for this. I don't have 10 minutes or I don't have 30 minutes. Forget it. That's not me. Once you start doing it, you're going to find that you become even more efficient during the day because you're going to be a lot more focused. So my recommendation to you is 10 minutes in the morning, 10 minutes minimum before you go to bed. Okay. You can easily just, with YouTube, listen. You don't have to be watching the video. Just listen to like a body scan meditation, or to there's tons of apps, like free apps that you can download that will give you that type of relaxation music. Do it for 10 minutes in the morning before you start your day and 10 minutes before you go to bed. If you end up falling asleep while you're listening to it, then no big deal. You're asleep. That's good. Okay, so that's not a problem either. So yeah, very, very helpful. Okay, so then of course the next one is smoking. Smoking is is a risk factor, for developing pneumonia, if you do come in contact with the virus. So if you ever thought in the past, I should be quitting smoking, right now would be the time to quit smoking. So smoking will increase your risk of developing a serious disease if you become infected with COVID-19. So you do want to, as much as possible, avoid smoking, vaping, or inhaling any substance which can be toxic to your lungs, okay? So this is a time to quit smoking if you've been thinking about doing so for a while. Regular exercise. Regular exercise is vital for your immune system, okay? So really, really important. In fact, the World Health Organization is now recommending that all adults should be exercising 30 minutes every day, especially to just keep your immune system healthy, so especially during these times, or 1 hour for children, okay? So it's really interesting for me to talk to patients. You know, I find there's two different groups of patients. There's one group of patients who have taken this time of staying at home or working from home, and now that they're not traveling, now that they're not commuting, they're finding that they have a lot more flexibility with their time, and they're just organizing themselves a lot more. They're going out for a walk in the middle of the day. They're going out for a walk at the end of their shift. They're drinking their water, you know, more frequently, as opposed to when they actually go into work. And then I have the other set of patients, and I'm not sure if you're one of them, hopefully not, that just find themselves gaining and gaining weight. You know, they're eating, you know, so much just because they're at home and the fridge is right there available, you know, to you. They're working more hours because they're finding it really hard to just shut it off, you know. So we don't know for how long we're going to be working from home. You know, we don't know for how long, you know, and we may never 100% go back to the way we were, you know, working before. I think to some level, things will change. So I think it's really important that from the beginning, right now, we start establishing healthier habits, okay? So exercising, maybe you're the type to exercise way more than the 30 minutes. If that's the case, then good for you. Please keep on doing that, okay? But if you're the type that you haven't been exercising for a long time, or you've just never been, you know, the type to get into a good exercise routine, then the minimum amount of exercise that you want to have right now is the 30 minutes every single day, okay? So go outside, go for a walk, go for a run. Of course, you want to keep away from others. So we're still allowed for now to go outside. Just keep your distance, okay? Oh, and the other thing that I want to mention to you, I don't know if anyone has heard of this, but sitting now is considered the new smoking, okay? So there's been some new studies that have come out saying that those people that are sitting, and me included, you know, I'm guilty of this too, we're sitting in a desk in front of a computer for hours without getting up and moving. That seems to affect our health just as much as we were smoking. Okay, so it's not a good idea. So if you do have an office job, you know, put a little timer on your phone, and every 30 minutes or every hour, just get up and stretch, you know, a little bit, even if it's for just a minute. But just sitting for a long period of time, for hours and hours, even if at the end of your shift you end up, you know, going for a jog, you know, outside in your neighborhood, it still doesn't fix the damage that has been done from sitting for such a long period of time. So it is really important, you know, just while you're working, to get up and walk around, stretch, and just try to get up from that chair, okay? Okay, any questions so far? Okay, well, I don't see any questions coming in. So just to let you guys know, if you have a question, there should be a little icon with a question mark where you can click and write your questions. So otherwise, I hope I'm just being super clear, and that's why there's no questions. Okay, so now we're going to talk about supplements. Okay, so vitamin C, there's been a lot of reviews, you know, made on vitamin C that I'd like to share with you. So vitamin C can act as an anti-inflammatory, can act as an antioxidant, can enhance our immune system, and it can also act as an antiviral, okay? Vitamin C in general has always been shown in studies to shorten the frequency, the duration, and the severity of any viral infections, including pneumonia. Okay. The typical dose of vitamin C is anywhere between 500 milligrams to 3 grams, per day. What's interesting to note is that the high levels of vitamin C, like after you take your oral dose, only stays elevated in your blood for the next 4.5 hours. Now, the best forms of vitamin C is a liposomal vitamin C. I don't know if anyone has heard about that. It just has a better absorption, level. Or if you can't find the liposomal vitamin C, or if you don't have that one at home, then hopefully the vitamin C that you have is one that has some flavonoids. A lot of the times vitamin C can come already mixed with some flavonoids, such as quercetin, which we've been talking about, rutin or hesperin, any of those. Okay, if you only have the vitamin C, then that's just as good. But yeah, so do know that after you take your vitamin C supplement, the levels, you're getting the most benefit and the most protection for the next 4.5 hours. So a lot of people, what they may do, for example, if you need to go to the grocery store, you need to go to the pharmacy, to pick up a medication, maybe take a vitamin C right before you leave, so that at least, while you're out there, while you're potentially being exposed, then your vitamin C levels, are higher in your bloodstream during that time frame. Okay. Now, if you do end up with an infection, an acute infection, whether it's this coronavirus or just anything in the future, a lot of people can benefit from a higher dose of vitamin C. Now, the only possible side effect is having some loose stools, so if this happens, and the actual dose in which vitamin C is going to give you the loose stools is going to vary, from person to person. For some people who are very sensitive, you may find that even just 1 gram of vitamin C can give you the loose stools. And then I've seen other people that can easily go up to 5 grams, and not get the loose stools. Okay. So you would have to just kind of experiment with it with your own body and see just how much you can tolerate. Now, if you do end up having the loose stools, is not a big deal. You just decrease, the amount of the vitamin C, and it should just, the side effect should get reversed. Okay. Now, some of the reviews have suggested that the more severe your infection, the more effective vitamin C seems to be, which I thought was very interesting. Yeah, the liposomal vitamin C, like I said, is a better absorbed, form of the vitamin C, so it can help us achieve higher levels of vitamin C in our blood. And there was another study that I thought was interesting that I wanted to share with you. Vitamin C shortens the time that patients need to be in a ventilator, by as much as 18.2%, which I found very interesting. The other study showed that taking vitamin C 2 grams per day was able to shorten the length of time that patients stay in the ICU, an intensive care unit, by 8.6%. So I don't know, given the low cost of vitamin C and considering the high cost of staying in an intensive care unit, maybe this is something worth exploring. Okay, so keep in mind, your vitamin C. Okay, so vitamin C and pneumonia. There was another study, Scottish study, a group taking vitamin C had 1 death versus a placebo group that they were not taking vitamin C had 5 deaths. Another study on influenza A patients, vitamin C reduced the incidence of pneumonia by up to 80%. So even though a lot of these studies are just small studies, I think the results are significant enough to justify, hopefully, further research, or just trying it out, because vitamin C is fairly safe and very low toxicity, to vitamin C, and something that could potentially help. So keep it in mind. Okay, so in other countries, what they've been doing is also doing IV vitamin C at the hospitals, okay? I'm not sure if in North America we're using IV vitamin C yet. I think they're looking into it, but there seems to be a bit more of a widespread bias against using vitamin treatments, in North America for some reason, for no explanation really. So hopefully, I'm hoping that, somebody is having a look at these studies that are clearly outlining the possible benefit of combining the vitamin C with the medications. So for example, this one is actually in the States, in Eastern Virginia, Dr. Paul Merrick, he was combining hydrocortisone, which, as probably many of you know, that works as a strong anti-inflammatory, with vitamin C and with vitamin B1. And this treatment was called the HAT treatment. And what they would do is they would start people on this IV 6 hours after entering the emergency room. And people would be given this treatment every 6 hours, pretty much. And they would be using it in patients either with septic shock or already people who have developed pneumonia. And the results were quite promising. What they found is that the mortality and the need for ventilators reduced significantly. The death rates reduced from 40% to 8.5%, which is a significant difference. Patients were able to get off of ventilators within 48 hours instead of 10 to 21 days. So again, very promising results. And again, remember what I said before, the more severe the infection, the more effective vitamin C, seems to be. Okay, so keep that vitamin C handy and in mind. There was another China study. So in China, what they did is in the hospitals, they would combine vitamin C, the hydroxychloroquine drug, which is the one in the media talked about, the most. That's an anti-malarial drug, and Citromax, which is an antibiotic. So they were combining all of those three in an IV, and they were also giving, which I found interesting, orally to patients melatonin and zinc. And what we're finding in general is that the mortality rate in China is lower than the mortality rate in many other parts of the world in terms of the COVID-19 infections, which is interesting to note. They also tried in China, interestingly enough, to do trials in patients only using IV vitamin C without the use of any of the other drugs. But it was just hard to find people that be willing to go on these trials. Most people would prefer to use the combination of the drugs and the vitamin C, but they were able to do the vitamin C only in about 50 people. And the good news is that the 50 people that received only the vitamin C, actually nobody died, which is good. But it was a very small trial, so I don't think, we can get very definitive sort of conclusions, from these small trials. So anyways, I hope that we're learning from the experience, of the Chinese hospitals, instead of just trying to reinvent the wheel. So again, I'm not 100% sure what's going on right now in the hospitals in North America, but hopefully, they're considering adding some vitamin C, to their mix. Okay, so the next vitamin that I want to talk about, which if you're one of my patients, you're probably taking, I'm hoping you're taking, is vitamin D. Vitamin D is one of my favorite vitamins to help boost up our immune system, okay? If you're my patient, we've probably done some blood work, to find out where your levels are at for vitamin D. If you're not my patient, you can easily go to your doctor at some point and ask them to, or you can go to your naturopathic doctor and ask them to do a blood test, on you. The blood levels ideally should be over 145, for the best immune system protection, okay? At this level, we can reduce viral infections by up to 42%, okay? So something so easy. If you don't know what your blood levels are at, and if you haven't been taking vitamin D, please know we don't get enough vitamin D from the sun. I have never seen anyone reach this blood levels by only being exposed to the sun. So please know that if you've never taken vitamin D, if you don't know what your blood levels are at, chances are you may be deficient, in vitamin D, and taking a small amount of vitamin D may be a good idea, okay? Elderly people seem to be especially vulnerable to having deficiency of vitamin D. And if you are deficient, you are 11 times more likely to have a viral infection, okay? So what's a typical dose? The typical dose varies greatly, and just your sensitivity level and your blood levels. So anywhere between 1,000 to 5,000 I use for adults, or about 1,000 for children would be typical dosages. But this last point is really, really important. You want to stop your vitamin D if you have signs of an infection. Why? There was one review, not too many, but there was one review that seemed to suggest specifically, I'm not talking the regular viral infections, I'm talking about specifically this COVID-19 infection. The review seemed to suggest that vitamin D can actually increase the inflammation somewhat if you have the signs of an infection. So now, just playing it safe, there's many other vitamins that you can take if you do get exposed to the virus, and if you start having signs of infection. But for now, either reduce your dosage of the vitamin D, or you can just stop the vitamin D, okay? So vitamin D should be more for prevention as opposed to for treatment, of an infection. Okay, let's talk about herbal. Oh, there's somebody with a question here, Colleen. Let me see if I can pull it up. Okay, so there's a few questions now. So Jennifer, hi, Dr. Miranda. Will your presentation be posted for us to refer to? I am balancing listening and helping my kids with school. Yes, Jennifer, of course. I'm going to make the recording available for everyone. I'll probably just be sending out an email. If you're in my list, and if you're receiving on a weekly basis my weekly health tips, then that's the list of patients who I'll be sending out the link for the recording. If you are currently not receiving my weekly health tips and would like to be added as part of the list, then please just send me the email at info@mynaturalclinic.com, and I can add you to the list. And yes, just give me a few days, to upload it into a YouTube link, and I'll be sending out the recording, as well, okay? The next question from Colleen. Hi, Colleen. Can you provide the name of a liposomal vitamin C and where to purchase? Well, that's a little tricky, Colleen, right now, because I think everybody has been purchasing liposomal vitamin C. There's many different brands, companies that make the liposomal vitamin C. You can just call your local health food store and ask them if they have it. I have personally ordered, I think I'm getting 3 or 4, liposomal vitamin C's, right now, but I can try to get a hold of some more. So if you are interested, and if you're my patient in getting some liposomal vitamin C, then again, just shoot me an email and I can hold one for you, okay? Also, I have heard that red bell peppers have vitamin C. True. Yes, they probably do have some vitamin C, although the food-wise, it's usually more the citrus fruits that we think about, as good sources of vitamin C, like oranges or lemons or limes. But just to give you an example, one orange will give you about 50 milligrams of vitamin C. So nothing wrong with eating an orange right now. Or in part 1, we talked about the quarantini, the non-alcoholic quarantini recipe with oranges and lemon that you can have as a way of boosting up your immune system. I've had a couple of patients who emailed me saying that they tried it and they loved it. So if you haven't tried it yet, please go back to the part 1, and get the recipe, and you can try that. But yeah, it'll probably be difficult to try to get at least 500 milligrams from just eating fruits and vegetables, alone. What would be signs of an infection? Well, usually the way people seem to be presenting, this infection, we talked about it at the beginning, is just kind of like, it's going to feel like a flu. So a fever, a headache, a dry cough, those are probably going to be more likely the first signs that you're going to experience if you've been infected. Okay. Okay. So herbal remedies. So the first one that I want to talk about is, I don't know if any one of you has heard of elderberry, or also called sambucas. And elderberry inhibits the replication and viral attachment of other coronaviruses. So again, we don't have any studies specifically with COVID-19, but elderberry has been studied with other coronaviruses. Seems to be the most effective in prevention of early stages of coronaviruses in terms of all the herbal remedies, okay? But again, just like with vitamin D, and I've been reading conflicting reviews, there's many reviews saying that elderberry is completely fine to take, in signs of an infection, but there's one or two other reviews that say no. So to keep in the cautious side and to keep safe, maybe just if you are going to take elderberry, then you can use it preventatively, but maybe avoid using it, again, just like with the vitamin D, at signs of an infection. Typical dose, if you do end up having an elderberry extract at home, or if you do plan to get this, then those would be the typical dosages. So about 2 teaspoons up to 2 once a day, or up to 2 teaspoons 6 times a day, which I don't think that would be necessary that much for adults, or just 1 teaspoon for children, or you can safely take 1 teaspoon up to 6 times a day. So this is just to show you how safe elderberry is, okay? But yeah, so there's a big range, of what we normally would take, in any herb. So it would just depend in each case. Okay, turmeric. Regular dose would be 500 milligrams daily if you are going to take it in supplement form. And again, I'm not expecting you guys to go out and start buying all of these supplements. A lot of people, especially, a lot of people that come to see me and that are my patients, you probably have, a lot of supplements already at home. So you want to just try, with all this information, try to pick and choose, which ones to take, right now. Turmeric is a fantastic anti-inflammatory herb. So definitely it has shown to suppress cytokine release, and it has actually in studies been shown to decrease the cytokine storm that we were talking about in Ebola outbreaks, which I thought was pretty significant. The other herb is Andrographis. So I'm not sure if any one of you has heard of that, but I use it a lot when people come in with just in general viral infections. So Andrographis Oregano Oil, they are great antivirals, antibacterials, and they also have anti-inflammatory activity. They have been used to stop other coronaviruses, again, not studied with COVID-19 specifically, but it may be an option, it may be helpful. Oregano oil, I'm sure you guys have heard me talk about. That's usually my go-to in general. I think it's good to kind of have it at home. It has a really long shelf life. As soon as you feel like, you've been exposed to anything, somebody has been coughing or sneezing, especially right now, but just in general, then coming home and taking a couple of drops of oregano oil is not a bad idea. The only thing to watch out for in oregano oil, it is quite spicy. So if you tend to have a bit of heartburn, or if you tend to have a bit of acid reflux, you may want to be careful, and not take as much, or only take it if your stomach is not bothering you, pretty much. So just be careful if you have acid reflux. Okay, any other questions? Let me check the question list. Okay, oh yes, Raisa, so you've also heard about elderberry, yes. Okay. So now I want to quickly talk about a few homeopathic remedies. Now, I don't know how familiar everybody is with homeopathy. If you're one of my patients, I've probably given you some homeopathic remedies along the way. But if you're not too familiar with homeopathic remedies, it's probably best for you not to experiment on your own, with homeopathy. Okay, if you wanted to take a homeopathic remedy, then please know you can just call me. We can have a quick consult and I can give you better guidance. But for those of you who are more familiar with homeopathic remedies, I just wanted to share this information with you. So pretty much, what is a homeopathic remedy for those of you who may not be familiar with it? Homeopathic remedies, they look like that little picture, you know, they come in little vials, and inside the vials, there's like a whole bunch of little white pellets that actually taste sweet. So a lot of the stuff that I give out doesn't taste very good, but homeopathic remedies actually taste pretty good. And these remedies can be made out of either a plant source, a mineral source, or sometimes even an animal source that has been shown through studies to give our immune system a bit of a boost so that our body can try to heal itself. Okay, it's based on the principle that like cures like. So for example, coffee in its natural form, you know, can make you quite, if you're drinking a lot, obviously, you know, quite anxious. It can give you insomnia, can give you heart palpitations, can give you racing thoughts because it's a stimulant. But if you take coffee in a homeopathic form, it's actually going to help cure somebody with that symptom picture. Okay, so if somebody comes to see me with insomnia and racing thoughts and heart palpitations, you know, and just kind of wired, then I may choose to give them a homeopathic remedy called coffea, which is originally made from coffee. Okay, makes sense? So that's how homeopathy is prescribed, is by the philosophy of like cures like. Okay, it's the second largest medicine around the world. So I know it's not very common for people who are more conventionally or traditionally minded to take a homeopathic remedy, but know that in Europe and in other parts of the world, homeopathy is very, very popular. That's where we get all our remedies from. When I talk about one dose in the next slides, what I mean by that is 4 pellets, 3 or 4, it doesn't make a big difference. 4 pellets under the tongue, it gets absorbed under your tongue, and you want to take it when your mouth is clear of any flavors. So you want to take it about 10 minutes away from eating, drinking, or brushing your teeth. Okay, so that's generally what I mean by one dose. Okay, so really interesting. Metallicum album is a very common homeopathic remedy that we would use for a number of things. The government of India has officially announced this remedy to be the one used for the prevention of this coronavirus outbreak, okay, which I found really interesting. So usually the symptoms that we would expect to see to prescribe Metallicum album is shortness of breath, unable to lie down, you need to sit up. So with homeopathy, we're always looking at symptom pictures, okay? So just because you come in with a headache, it doesn't mean it's like, oh, I know which homeopathic remedy. No, I need to know exactly what your headache looks like, what type of headache, what makes it better or worse. So these are the symptom pictures that we study, and we figure out, okay, which remedy best matches that symptom picture. So that's how we prescribe homeopathic remedies. Homeopathic remedies work like a charm. They work really well as long as we're choosing the right remedy for you. If we're choosing the wrong remedy, then nothing happens. You just pretty much continue with the same symptoms. So there's very little side effects to homeopathic remedies. But yeah, once we choose the right remedy, then it can give you quite a good boost and it can really help people heal quicker. Okay, so Metallicum album specifically is for shortness of breath, for the dry cough, you know, that's usually worse at night, feeling better sitting up. There's usually a lot of burning sensation with Metallicum album. So if you have a burning all over your body, especially in the chest, then that can be a keynote, you know, for Metallicum album. Usually Metallicum album has a lot of restlessness and a lot of anxiety, especially when that develops at nighttime. So if we have a patient who's coughing, but they're just really still and really calm in bed, maybe not the symptom picture for Metallicum album. It would be more the type of people that get up and they can't find a, you know, comfortable position and they want to pace around. And that type of symptom picture, that's, you know, what we're looking for in order to prescribe Metallicum album, okay? Usually there's also acrid and putrid discharges. Okay, there was another remedy that has been sort of reviewed, you know, right now, and it's called Bryonia. Some people are recommending Bryonia 30 twice a week. for prevention. If you're in quarantine, they're recommending Bryonia 30 CH, 1 dose per day for about 3 to 5 days. Or for mild symptoms, you can do a 30 or a 200. That's the stronger Bryonia every 6 hours. So that's different ways that you can try the Bryonia. But the symptom picture for Bryonia is very specific. Usually there's a dry, hard, painful cough. So these are the people that when you're coughing, you have to hold your chest or you have to hold your head because just everything hurts when you're coughing. The cough is so strong that you need to hold your chest or hold your head. So this can be very, if you can imagine, this is very common in pneumonia, right? Cough is worse eating, worse motion, entering a warm room, very painful headache, especially while coughing. You feel like a cold sensation traveling down the chest. These are usually patients who are extremely thirsty. So that always helps us to identify which remedy can be helpful as well. So if these are your symptoms, maybe think about Bryonia, okay? The other remedy that has been sort of reviewed is Camphora. This one is not as common a remedy, but this one is more for when you get to a state of already a collapse. So I think this is more for like more advanced, cases. There seems to be a cold sweat. There's usually, as opposed to Metallicum album, remember that one had a lot of restlessness. This one doesn't have a lot of restlessness. There can be shivering and chills. You just want to lie down. You can't even sit because you're just so exhausted and so fatigued. And usually with these symptom pictures, there's no thirst, as opposed to Bryonia, people would normally be very, very thirsty, okay? So, and that gives you some idea as to what to do for mild infections, severe infections. So, hopefully I haven't confused the heck out of all of you by now. Any questions? And then I'm going to give you summaries, okay? Okay, so I think, what dose of the Metallicum? Okay, so we're going to talk about that, Raisa, right now. For some reason, my computer had problems at various times throughout the seminar. Will it be? Yes, I will be making the recording available, Debbie. Okay. Okay. So summary. So again, I need to emphasize, these are not supposed to be replacing any medications or any treatment that the medical doctor is giving you. Okay. So please keep that in mind. Okay, so ideas for prevention. If I'm going to quickly, please take a picture, okay? So you want to consider your vitamin C. You want to consider some zinc. If you're taking the zinc, hopefully you want to take it with some quercetin. Or if you don't have the quercetin, then have it with some onions, okay? Because you find quercetin in onions. You can also combine the zinc with green tea. If you're taking too much zinc, one of the possible side effects is nausea. One of the possible side effects of the vitamin C, by the way, is loose stools. We talked about that. You want to consider maybe taking some melatonin, especially if you're a little older, especially if you feel your sleep is not 100% perfect, or that you're not getting into deep sleeps. If you've always been more of a light sleeper, then maybe consider, taking right now some melatonin. It may actually help with your sleep anyways, but it can definitely help protect your immune system. You want to consider vitamin D for prevention. If you have elderberry, which is the sambucas, you can consider taking that for prevention. For prevention, I would recommend more the Metallicum album 30 for prevention. You can do 1 dose once a week. You can take 1 dose twice a week, and that would just be preventatively. Or, that's more from India, the recommendation from India, or from Iran, it's more the Camphora, so that's an option as well. If you do have mild symptoms, then you want to stop the vitamin D, you want to stop the elderberry, but you should be okay continuing with your vitamin C. And the vitamin C, if you notice, the dosages are always like 4 times a day because of what we said, that the vitamin C only goes up for just a certain number of hours after taking the vitamin C. You can consider it's okay to continue to take the zinc, you can continue to take the quercetin, you can continue to take the melatonin, and of course, any other treatment that your doctor has prescribed, okay? Things that you may want to consider avoiding during the infection. We talked about the elderberry, we talked about the high levels of vitamin D. We didn't talk about echinacea or the larch, which is other immune system herbs. But yeah, just for now, avoid those, if you do have signs of an infection. Things that are likely safe to use during the infections are all of those. Some of them we talked about, some of them we didn't get to, but you can just take a picture of that. This is a reminder to everyone, how to access COVID-19 testing. There's that link. If you didn't get it last time, please take a picture of it. If you do start having symptoms, then this is a link that gives you, asks you some questions, and it's kind of like a self-assessment tool. There's a phone number for telemedicine, for telehealth, 1-866-553-7205. And if you're not sure, then you can always just call them and they can direct you. Okay. Those are some reliable sources. Again, I offered this in part 1 so that the information that you're getting is reliable. I would recommend, visiting these websites as opposed to just getting them from sources in the media that may or may not be reliable. Okay. Okay. So even though hopefully all this is just seasonal and it's all, some people say it's going to go away in the summer, but it's probably going to come back during the fall. Nobody really knows. What we want to do is we want to try to slow down, flatten the curve, like they're saying, and hopefully, this is going to give researchers a little bit more time to continue investigating more as to what medications can help, what natural therapies, can help. Experts say that an estimated 40 to 70% of the whole global population will end up contracting COVID-19. So what we want to try to make sure is that we're in that high percentage of people that just end up getting the mild symptoms. And hopefully a lot of these tips are going to help us, do that. Continue keeping good hygiene, continue keeping social distancing as good measures to try to slow down the spread of the virus. So now I have a question, for all of you. For that group of people who are finding really difficult to stay on track now with this new routine, or who have been finding that you're at home and you're just gaining weight, you're just eating all sorts of things that you shouldn't be eating. All that is not healthy for your body. It's not healthy for your immune system. So what I want to know, just from a show of hands, the interest, if anyone would be interested, I don't know whether I should be offering this or not, but I just want to know if people would be interested. I want to offer like a 10-day express detox. So what that would entail is we would be meeting 3 Wednesdays in a row. So for example, just to kind of keep this rhythm going, we can continue doing it on Wednesdays from 12 to 1. It would start next Wednesday and we would be meeting for 3 Wednesdays in total. So the idea is that the first meeting, we would, I would talk to you about how to prepare, for the detox. So you would take about 3 to 4 days to prepare for the detox. And then you start the 10 days, on day 3 or 4, more or less. You start the 10 days, at that point, we talk about when it's important to buy organic, whether you need any supplements or not during the detox. Most people are okay just doing it with food alone, but, some people could benefit from some of the supplements, so we'll be talking about that. Tips to be successful. And then I'll give you the starting point of the detox. And then the next Wednesday, you've already would have started, with your detox for about 3 days or so. And on the second Wednesday, I would give you the indications on how to continue with the rest of the 10-day detox. And then and I'll give you lots of menus and recipes that can help you. And then the last Wednesday that we meet, we should all, and I'll be doing this with you guys, and we should all be finished our 10-day express detox. And then we'll talk about more just how to maintain, healthy habits, how to keep up. Normally people, when they do a detox, they feel a lot more energy. Usually inflammation goes down, which is in part the reason why I thought this would be an excellent time to do this as a group together. How to deal with, well, nobody's eating out, but when you're ordering out, how to deal with things like that, and, what supplements, if any, you should be taking on a regular basis. So normally, I would, the cost to do a program like this, would be $330, but because of the current situation, I want to offer all 3 sessions, so the whole thing, for just $97. So I'm thinking about doing this. What I'd like to see is just if you can raise your hand if you think you may be interested. It's not a commitment right now. I just want to know if people are interested, in doing this. Then I can send out an email, and okay, so I do see some people interested. Perfect. So I'm going to put all this information together, and I'll send out an email with a link. If you are interested, then you can register, and then I'll be contacting you. It would be again on the Wednesdays from 12 noon to 1 o'clock. Okay. After you register, I'd be sending you a detox questionnaire and a 2-day diet diary for you guys to fill out. The detox questionnaire is really, really helpful because we're going to be filling that out at the beginning of the 10-day express detox and at the end as well, so that you're able to see not just by the way you're feeling, on the progression, of how much you benefited from the detox, but also in numbers, all your symptoms, because sometimes things change kind of subtly and people don't realize, for example, that their headaches are getting better, that their joint pain is getting better, that their energy is getting better. So filling out a detox questionnaire at the beginning and at the end is a really, it's a great way to actually monitor, those changes. Okay. So I'll be doing that, and yeah, and hopefully we can all get started for the 15th. So at this point, I'm just gonna check to see if there's any more questions. Let me see. Okay, so there are some more questions here. Okay, so Raisa, I think I might have answered your question, the dose of the Metallicum album. So for prevention, what most people are doing is the 30 CH, and you can choose to take it once a week or twice a week just for prevention. Can one use pascoleucine? Absolutely, Julia. That is not, that is a complex homeopathic remedy by a company called Pasco. And that's normally used, for flu type symptoms. So if that's what you have at home, then yes, that would be okay to use just a few drops every day, or you can just take a few drops every other day, Julia, because I know you're a bit sensitive, just for prevention. And that one would be okay to use, if you have signs of an infection. Colleen, if you were sick and wanted the Metallicum album or Camphora, you should be able to find these in health food stores, Colleen, but I would highly, highly recommend, if you are going to take a homeopathic remedy, to just give me a call first. Let's have a quick chat and let's make sure that you're taking the right one. Okay. So supplements and herbal remedies, those are easier to kind of, play around with and experiment. But if you don't have a lot of experience with homeopathic remedies, then that would be my recommendation. But technically, you don't have to get it from me. You should be able to find these remedies in health food stores, as well. What about alcohol? Heard you should avoid. Yes, Colleen, we talked about alcohol in part 1. So I don't know if you got a hold of the link for the recordings, but yes, alcohol is something that ideally should be avoiding, especially if you're the type to drink every day. Some people do, like 1-2 glasses, with dinner. That's not a good idea right now. I mean, it's okay if you want to have a glass maybe once a week, twice a week, follow it with tons of water so you can just flush it out, but definitely not on a regular basis right now. Is detox safe now? Does your immune system decreases while you're detoxifying? That's why I want to do this type of detox, where I can, because I talk to people about being a beginner detoxifier versus a more, like I have some patients who come in and they fast like they drink only water for days, you know, and their bodies are used to doing something like that. That's not the type of detox I'm going to recommend for somebody who has never done a detox, you know, before. So we talk about this, you know, during these sessions. Detoxification can be extremely helpful and healing, and can actually enhance and balance our immune system, but it needs to be at the right pace. So for example, if you're currently drinking 5 cups of coffee a day, you're not going to decrease it from 5 to 0 from one day to the other, because that's going to be too harsh on your body. So yes, we do talk about all this, Debbie, you know, during the detox program. Cheryl, thank you. You're very interested. Yeah, I'll make sure you get the email, you know, with the link. Maureen, great idea, but it is difficult to get the food. Well, the grocery stores, Maureen, are still open. If you're not leaving your house to do grocery shopping, I think there are some delivery services. The main idea is to eat more whole foods. So hopefully, you know, and maybe what I'll do is during the sessions, just give you a lot of options. So in case you don't have one thing or another thing, maybe you can do have other options. So yeah, so we'll work around that, Maureen. I think we can still do a really good detox, you know, at these times. I think it would be really helpful. Okay, so with supplies being low and an ability to shop. Yeah, so Maureen, if you're interested in doing the detox, and if you're having problems, if you want to just email me asking questions about substitutes, then please do so. I think we should still be able to do a good detox. Dawn, I have recently been diagnosed as pre-diabetic. Will this detox help on my road to weight loss? I have gained a lot of weight due to chronic lower back issues and not able to exercise. So absolutely, Dawn. So again, I think the main thing is to really establish and try to figure out, and this is why we don't start the detox right away. We take a few days to prepare to start the detox. So a detoxification can be extremely helpful for pre-diabetics. It can help to lower your insulin levels. It can help to lower eventually your hemoglobin A1C. I always tell patients, use, you know, I've done this 10-day express detox with many, many patients on a one-on-one, and we use it as a catalyst to kind of start eating healthier. As your blood sugar dysregulation gets better balanced, you should find your inflammation decreases. And you should find that a lot of the aches and pains that you're currently experiencing, Dawn, is improved, okay? Raisa, oh, I think I lost it. Okay, I think we have a few more questions. Raisa, if you can't find the Metallicum album, then just send me an email. You know, I can make it available because we have it here at the clinic. Yes, let's watch out for Easter candy. That's a good suggestion, and you're welcome, Cheryl. Okay, so I think I've gone through all the questions. So thank you so much for attending today. I know we went a little bit over time there, but again, if you're not part of my weekly health tips, send me an email. My email is info@mynaturalclinic.com, and I will make sure you get included, or if you know anyone who may benefit from the detox, again, just give them my email, and I'll be happy to include them in the list so they can get the information as well. So again, I am really enjoying, you know, connecting with all of you guys online, and I'm looking forward to doing this program. I think it's going to help us all, you know, in many different ways. And until next Wednesday, thank you so much for attending, and keep safe, and all the best. Thank you.